Right, we shall walk about from Ghana and Sam TV. So, me say, John Dramani Mahama Bino, Ebema Ghana for any Adaho. Menoka say the cash and carry is back.
And to many health facilities across the country tonight, with the national health insurance scheme left crippled by a collapsed system. Patients are being turned away or forced to pay out of pocket. Some facilities have begun improvising by activating manual claims verification procedures. The head of the National Health Insurance Authority, Dr. Victor Asare Bampo, has been left alarmed following a visit to some facilities to assess the impact. My colleague Papani Ashali joins me in the studio now with more on this unfolding development.
Well, firstly, we know that the director or the CEO for NHI himself is going around trying to assess what the problem is. What again we know is that from our checks is that this is not a one-day thing. This is something some people in fact tell us that at least has been happening over the last 1 week. The exact problem we may not be able to tell, but as with the electronic systems, we know that this particular system that is being used is the National Electronic Health Records and Hospital Management System, a very vital system or platform that the NHIS and the hospitals or health facilities use to enter their claim, to verify their claim, and again, eventually to assess and receive their claims. And this is a system that is currently, that only means that when you go to the hospital, when you're supposed to be keyed in as somebody who benefited from the NHIS for which the hospitals will go and take their claim. This is the system that is now problematic, that for some people, almost 1 week hasn't worked at all.
NHI himself has been visiting some of these hospitals. What are his findings? Well,
we know that he's been to two major places. He's been to the whole hospital again, and then he's been to the regional hospital, trying to assess for himself the situation on the grounds and the impact on it. What we also understand is trying to understand in this situation is to know how exactly we can work around the system as it stands now, and also to proffer solutions how we can move this system forward.
Papa, so what did we find when we visited Bcoz SDA hospital, for instance?
So we've been trying to understand what exactly this means on the ground. And at Bcoz hospital, what we are told is that you know that when you walk into a hospital, one of the first things you have to go through is to go to records. And at records, what we understand is happening, or what we saw happening at Bcoz, is that if you go to records, the normal thing is for your name to be entered into the system or checked from the system. That system, because it's down now at the moment, we are asked to go through a different system where you now asked to actually pay for some of the services that you have to go through. We spoke to some individuals who had been turned away because they insisted on going through the NHIS system, and unfortunately, because the hospital didn't have it, they asked them to go back to wherever they came from, find an alternative hospital. We can listen.
We said their card, they have to pay physical cash before they can do it for them. So they didn't really say anything. They just told us the system is down and it's everywhere for about 2 weeks. So I heard the nurse was even saying that a gentleman and a wife gave birth in the maternity, and then the prices shoot up, and then the man was complaining bitterly because he thought NHIS would sort part of it. Of course, or if the system is down, they have to do something about it, because you cannot afford, it's not everybody that can afford healthcare without NHIS attached to it. So I think 1,500 or so. Yeah, 1,500. I can't really give the figure, but I don't think that I've even gotten through how.
But Michael, I know that you also interacted with the patient. They had their card with them, but still had to pay out of their pockets.
Yeah, so firstly, because ordinarily what we understand is that the NHIS system more or so cuts in half how much you actually expected to pay at the various. In some cases, in fact, absorbs the full cost of your processes at the hospital. You're going to see a doctor and the medication and everything. But in some cases, we know that you have to pay, or the card only covers half. For this particular person that we interacted with, although you have your card, the system is not working. So it means that we cannot lay claim to whatever services we render to you. And at this point, that particular person was asked to go ahead and actually decide to pay for the services, and that particular person actually told us that they had to pay for consultation and again for some of the medication that he in particular was given at the Bcoz hospital that we met him and interacted with him. We can say that, I mean, for some of those who are in those situations, appear at the hospital, banking our hopes on this system that we expected it to work. And that's where the major problem is, to meet with disappointment and ask to...
Debbie, now be home. Carry no. Yes, see, you can't see. Debbie now bedding, Ubehu. His Excellency John Dramani Mahama, aka John Bosco, a bino and our Baby Diagro. Medawoka say dear, health insurance, yeah, His Excellency the former President John Ajakum Kufo dear woo at the Bayano. Or making sure say Ghana for a banya Irish free, Amuncha Teku and a Sempoa. Medawoka say dear, His Excellency John Dramani Mahama, aka John Bosco, aka Bole Bamboy, and yet Eeii Amin. Medawoka say dear. Now buying a John Dramani Mahama number 2. A buying a 100 mamufona, the 3 more days upon some. Medawoka says, I buy no Asamba Biomua. Health insurance, Jadisha I for free hospital no. Medawoka to the system no. I run it down watch as a bushia. Uko drew hospital now, so we are ready and now in this cadia. And then I kofie, kowu, kofie, kowu, kofie, kowu, kofie, kowu, kofie, kowu, kofie, kowu. Kofie kowu no baka kowu. Esan say, what to abama o difo ni trimodem for on juni ni panwa. Na o juni no nkwane fu ni nebusha fo ho a. Say no man no tete kowie. Ni pa ni trimodem no, ye mani ndi oman enim. Nurses for ye juma busumidu. Teacher for busumidu ba kudu mienu du miensa. Why ye for? Ono nkasa ni minister simple. Enya ade a otu omuka. Me say obi opon be say 133 no and then one nimpontimi ntua na nko de 33 na ka ho. Eyezu na wa document section mu say ebusua aye awura wo sem a enya asem keto a kire sem no ka say de ukokopiamu e wo hospitals a e wo man we mu a awura wo sem no ene say ayarefo a omukita health insurance ni na no ebusua nya de ye show mo kire say so woni ska wo de betua de ya na kire say obusua ni no ya we no. Oh my God, oh my God, oh my God. That's what I say obeye eye nyamedia. Me say what to ababone a obeti wo be nka. Say what to ababone a obeti wo be nka. Eno tina me to fode bia say ko to aba. To abama aban a odwene wo ho. Enya aban a ondwene timamufo no mfa timamufo ehia asem enye ne hia asem. De oni mu ani say on the bush for me did no matter. The Tamfon become dear, and funny home, Sadi Paddy Ferno, Bole Bamboy, John Bosco. And on Tenominoka say, dear. O papa, Unia, one cassa now, Mamma Busani be already are. And the old car, no boy, Sicano, or Botomania, who drew hospital Honomoa, was soon, Bashi. It's answered John Dramani Mahama, aka John Bosco, a bino naba. Because I'm still down to Yamasa. Say how? Yes. Say ya the baby. Because me tooth was 20, yes, it's a tooth no went ya. What can't ya? Yes, the tooth now went ya. What can't ya? And nothing and net health insurance no. I am watching be aiding. Higher Ghana and Sem TV. Idi am just so any promise. My own wadwen to comment section ni mu. Dear John Dramani Mahama, e dey Ghana for no. Eye, ana say nye. Wadwen to comment section ni ba bo ma bibia no so aye kama, na no so aye kama so no e wo ho. Mahama is the hope. He gives you hope. He gives you hope for Mother Ghana. Ebusuya, me ne wo ka say there. Cash and carry returns as frustrated patient lament NHIS system breakdown nationwide. If I'm breaking you more, me ne woka say there cash and carry. Say we do hospital, I see to ya answer ni ashe no. Asanso ababiom. Patients a refor no. me no ka say dey omo kire mu say health insurance no uduru hospital a me no ka say no system no break it down kire say enye adwuma busua patient no aye frustrated just say omo ye basa kire say omo ni so omo eje omo hu de omo nye isan say John Dramani Mahama aka John Bosco abana saba NDC abanya ondwene Ghana for ho oba oma oman mu entimamofo no ho mo kire omo no wasan ba biom na wasan de cash and carry naba under NDC health insurance nye adwuma under NDC bibia eye papa bia MPP de ba ye bia no mo ba omba be sei no eno nti na me sei senka Ghana fo nyina no adwen no eye adwuma te se de MPP fo adwen ye adwuma na anka there is no way NDC as a political party I want for one social intervention emba be bo oman Ghana nkomba ba ba yamu nenso na am say Ghana the 8th country the lowest IQA e kire say 54% of Obama John Dramani Mahama no omo na amaye dasa no eno na amaye we bi we nkenya sa nka yenkoto Obama John Dramani Mahama ina me no ka say no cash and carry MPP be yi free ono ensan so embabiom eyezu